Hey, good afternoon, everyone. I think we'll get started. Some people are still joining us, but we'll make a start. So many thanks for joining us today to hear about the findings from three of our published reports that provide insight into the out-of-home environment in Scotland. Today, we are joined by Caroline Litz, Senior Public Health Nutrition Advisor, Clodagh Elric, Dietary Advisor, and Lindsay Davidson, Public Health Nutrition Advisor at Food Standards Scotland. We'll also be joined by Laura Wilson, Head of Public Health Nutrition at Food Standards Scotland, for the Q&A session at the end of the presentations. The webinar today has been endorsed by the Association for Nutrition as CPD until the 11th of July 2027. So to assess the effectiveness of this webinar, we will shortly be asking you three brief questions at the beginning and also at the end of the webinar. This will help us measure any learning gained. We'd be very grateful if you could take a moment to complete these questions, and the poll is completely anonymous. As we're on Teams Live, you will not be able to unmute your microphones to ask questions, but we do welcome questions and any comments you may have, and you can post these into the chat, which will appear at the side of your screen at the end. We'll have time for questions and hope to be able to answer as many of them as possible. The webinar is being recorded and will be shared in due course. And before I hand you over to Caroline, I'm just going to make the poll live. So I'm launching this poll now. And it should just pop up on your screen. There's three questions. So if you would please be able to just take a moment and answer each question. I'll just leave it open for the session, and once you've answered, you can just exit from it. And then we will move on to Caroline. But I'll let you, hopefully everyone can see that. So Caroline, I don't know if you want to start, and we can just let people take part in the poll. I can see people responding, so happy to pass over to you, Caroline.
Okay, that's great. Thank you, Sophie. Welcome, everyone, and thank you for attending this webinar today and taking your lunch break to hear about the findings from our recent out-of-home publications. As Sophie mentioned, my name is Caroline Litz. I'm a Senior Public Health Nutrition Advisor, and one of my key areas of work is focusing on the out-of-home environment. We really hope that you enjoy the webinar, and we will welcome questions and look forward to the discussion at the end. So at Food Standards Scotland, we are Scotland's national food body, established in 2015 by the Food Scotland Act 2015. We have a unique role in government, working independently of ministers and industry to provide impartial advice based on robust science and data. We have a statutory duty to improve the diet in Scotland, and in line with this, our vision outlined in our 2023 Public Health Nutrition Strategy is to have a healthier and more sustainable food environment. We're a science and evidence-based organisation, and we're working to provide expert advice on achieving a healthier diet. All members of our team are registered nutritionists for the Association for Nutrition, and we work collaboratively to drive policy aimed at improving the Scottish diet and the food environment. Today we will be exploring some of the research contributing towards our understanding of the current out-of-home environment in Scotland. But before we start, it's useful to define what we mean when we speak about the out-of-home environment. At Food Standards Scotland, we define the out-of-home sector as including cafes, all types of restaurants, takeaways, pubs, bars, vending machines, workplace canteens, and more. Supermarkets and convenience stores providing food on the go, which is food purchased for immediate consumption. Places where we purchase food when we commute or travel. Those who are manufacturing and supplying food to the out-of-home sector. Food delivery services, including those which are online. And out-of-home businesses in the public sector, including food provided to staff and visitors in healthcare settings. Just listing what is included in this definition highlights the breadth of out-of-home and highlights that really it isn't limited only to takeaways, deliveries or restaurants. So, unfortunately, the Scottish diet for both adults and children we know is too high in energy, free sugars, and saturated fat, and it's too low in fibre and fruit and vegetables. Two-thirds of the population are living with overweight or obesity, and poor diet and obesity are risk factors for several non-communicable diseases, such as type 2 diabetes. But to make steps towards improving the diet of the population, the focus should move away from the individual and instead consider the environment in which we are surrounded. Various factors within the food environment could play upon our biological, social, and economic vulnerabilities, potentially encouraging us to overconsume on less healthy foods. Eating out of home isn't anymore a treat, but it is commonplace in our society, with the most recent National Diet and Nutrition Survey estimating that out of those who do eat out of home intake is contributing 23% towards our total energy intake. Out of home has been the focus of our work for several years now. In 2018, following recommendation in the Healthier Future Diet and Healthy Weight Delivery Plan, we sought views through a public consultation on a range of measures to improve the out-of-home food environment in Scotland. In 2019, we published a board paper in which we made recommendations to the Scottish Government for an out-of-home strategy. Following that, in 2021, the Scottish Government published the Diet and Healthy Weight Out-of-Home Action Plan, and this aimed to create a healthier food environment in out-of-home settings. Over the last decade, we've commissioned a suite of research monitoring and evaluating the out-of-home environment, and this has contributed towards the evidence base. We also support policy development. For example, we're working collaboratively with Public Health Scotland to develop the Eating Out, Eating Well framework and the Code of Practice for children's menus. And this aims to support out-of-home outlets to provide healthier offerings in their establishments. So today we will be sharing the key findings from our three most recent publications relating to the out-of-home environment. First, Clodagh Elric will explore food and drink purchasing habits out of home in Scotland based on Kantar World Panel purchasing data. Then Lindsay Davidson will explore the impact of promotions and marketing strategies on consumer ordering behaviours in the out-of-home digital market, research which was undertaken in collaboration with Ipsos. And finally, I will present the nutritional content of popular out-of-home foods, research which was undertaken in collaboration with Nesta. All three of these reports have been published and they can be found in the out-of-home section of the Nutrition Research Hub on our website. I will now hand over to Clodagh to share her slides, who will take us through the out-of-home purchasing habits in Scotland. Thank you.
Yes, thank you, Caroline. I'll just share my screen. Yeah. You all see that, yeah?
Yeah, we can see that.
Thank you. So yeah, as Caroline said, I'm going to be highlighting some of the main findings from our report on out-of-home food and drink purchases in Scotland and Great Britain in 2022 and 2023. So this report is the latest in a series of publications from Food Standards Scotland on purchases made in the out-of-home environment, which we monitor as part of our dietary surveillance programme. So we use data from reports like these alongside other evidence to drive, influence and monitor public health nutrition policies aimed at improving the out-of-home environment and diet of the population in Scotland. So the out-of-home food environment in this report refers to any food or non-alcoholic drink bought and eaten away from home. So this includes dining out, food on the go, and any takeaway or home delivered food. So this research includes insights into where, how, and what people are buying out of home in Scotland. The report is based on our analysis of data from the market research company Numerator, who were previously known as Kantar. So panelists recorded all of their food and drink purchases using an app, which allows data to be collected in the moment. The out-of-home data comes from a subset of Kantar's take-home purchase panel, and within this there's also a subset of consumers who record additional details about their purchases, which focuses more on the way that the products were consumed. So one or two things to note are that social class was used in the absence of robust data for SIMD, or Scottish Index of Multiple Deprivation, when looking at differences by socioeconomic status. The other is that findings are reported for Scotland where possible. However, where data for Scotland wasn't robust, we presented results for Great Britain. So the data is gathered on out-of-home purchases from a variety of outlets, or channels as they are referred to in the report. So this includes quick and full service restaurants, cafes and coffee shops, supermarkets and convenience stores, pubs and bars, bakeries and sandwich shops, and any other locations that you could buy food or drink out of home, such as work canteens or vending machines. As an overview of 2023, 98% of the Scottish population visited the out-of-home environment, with consumers making an average of 4 trips per week. So in total, 869.2 million out-of-home trips were made in Scotland across the year, which is an 11% increase on the trips that were made in 2022. In both years, males and those from a lower social class, so that was social class C2DE, made more trips to the out-of-home environment on average than females and those from a higher social class. So in line with the overall increase in out-of-home trips, the number of trips to all outlet types in Great Britain increased between 2022 and 2023. So in 2023, we tended to visit outlets that offered more options at lower price points, such as convenience stores and supermarket locations. Between the years, there was a 19% increase in the number of trips to convenience stores and a 27% increase in trips made to supermarket locations. Meanwhile, trips to pubs, bars, and full-service restaurants, where dining usually comes at a higher cost, remained relatively low, with little change compared to 2022. So the highest proportion of out-of-home eating occasions in Scotland in both years were for food on the go, followed by dine-in and then takeaway. So for context, food on the go counted as items purchased and immediately consumed away from where it was bought, rather than items taken home like takeaways. So a similar pattern in food on the go popularity was seen in Great Britain, with supermarket main stores being the channel where the greatest proportion of food on the go was bought. So meal deals have previously been found to be popular when buying food on the go, with FSS research showing almost half of main meal food on the go products to be available as part of a meal deal. In both 2022 and 2023, snacking made up the majority of out-of-home meal consumption occasions in Scotland, with the greatest increase compared to other meal types. So the data in the arrow on the right indicates the growth in high-level food and drink categories. So among these, cold drinks featured in the greatest number of trips in 2023, with carbonated drinks being one of the top subcategories. Sweet snacks saw the second highest increase in trips year on year, and notably 10% of all out-of-home trips in 2023 included items from the cakes, pastries, and biscuits subcategory of sweet snacks. So although this report didn't focus on the nutritional composition of the foods purchased, previous research undertaken by FSS has demonstrated that sweet discretionary products sold out of home average around 450 calories. Considering that these are typically eaten out with and in addition to meals, these products are likely to contribute towards excess intakes of energy, fat, sugar, and salt. In addition to data from 2022 and 2023, we also considered 2021 data when looking at the takeaway and delivery sector to assess how the market has evolved following the significant peak during the COVID-19 pandemic. So the total takeaway sector experienced a decline in overall value between 2021 and 2022. However, data from 2023 indicates a small rise in trips, although this is still below levels seen during the pandemic. So Kantar splits the out-of-home takeaway market into collection, drive-through, and delivery. And across all 3 years, most takeaway trips were made via collection drive-through, with delivery making up a much smaller share. Since the COVID restrictions were lifted in 2021, delivery has seen the greatest decrease in trips. Third-party food apps and sites such as Just Eat and Deliveroo remained the most commonly used means of ordering for delivery across Great Britain in 2023, while the majority of collection drive-through purchases were ordered at the counter. Burgers were the cuisine type that made up the greatest percentage share of takeaway main meals in Scotland in both 2022 and 2023, followed by chicken meals and then pizza. So as a percentage share of out-of-home trips, 5.7% featured a promotion in Scotland in 2023. It's important to note that this is likely an underrepresentation, as this data is defined by panelists from a predetermined list. This means that where a promotion or a discount is consistently offered, or a discount is automatically applied, such as for meal deals, multi-buys, or digital ordering discounts, these might not always be recognised and captured. So as we were aware of both the heavy presence of promotions out of home and the continued use of food technology, we decided to explore this further, which is what Lindsay is going to present to you now.
Thank you, Clodagh. I will just share my screen. Okay. Good afternoon all. I'm now going to share a piece of research that Food Standards Scotland commissioned last year to explore the impact of promotions and other marketing strategies on consumer behaviours when ordering from the out-of-home digital market in Scotland. For the purpose of this research, we focused on the out-of-home digital market, which covers all food and drink that is ordered online for collection or delivery, either through an outlet's own website or app, or through third-party platforms such as Uber Eats, Deliveroo, or Just Eat. Our previous research had shown that during 2020 there was a rapid growth in the takeaway and delivery market, and digital methods were found to play a key role in this growth, leading to changes in how marketing strategies and promotions are used by outlets in the out-of-home environment. So we wanted to understand if and why promotions and other marketing strategies impact on how often consumers order from the out-of-home market, if and why they have an impact on the volume of food ordered, and whether different promotion types have any influence on consumer behaviours in any other ways. The study was small in scale and primarily qualitative in nature. It involved 29 adult consumers living in Scotland who already regularly used digital methods to order food from the out-of-home environment at least once per week. The research was split into two stages. So stage one involved the collection of real-time data on consumer behaviours. Participants were asked to complete a 4-week online diary task during which they used an app called Endemo to screen record their ordering process of each food and drink order that they placed online. Stage two then consisted of a follow-up in-depth interview with each participant to understand further the impact that their exposure to promotions or marketing strategies had on their ordering behaviours. The combination of both stages was really key to addressing the research objectives without relying on participant perceptions or self-reporting. Over the course of the fieldwork period, a total of 106 orders were placed among the 29 participants, and the most common time to order was in the evening, with 75% of all orders placed then. The most common days to order were Fridays, surprisingly followed by Mondays and then Saturdays. The most frequently mentioned reasons for ordering was for a treat, for example, when friends or family were over, or for convenience, including being too tired to cook, finding it easier to order rather than cooking. Third-party platforms were also found to play a key role in consumer decision-making within this study. 67% of orders were placed using a third-party platform, such as Just Eat or Deliveroo. Participants appeared to like them for their ease and convenience, as well as the promotions that they offered and the ability to compare promotions easily when ordering. Only a third of all orders were placed using an outlet's own website or app. Within the 106 orders that were recorded, a staggering total of 652 promotions and other marketing strategies were observed as participants made and placed their orders. These included a range of different promotion types, and I'll go into these in more detail on the next slide. However, the most prevalent types were price promotions and upselling strategies. Overall, promotions or marketing strategies were taken up in 74% of the orders made, and the average number of promotions that participants were exposed to when placing their order was higher when participants used a chain outlet's own app or website compared with an independent outlet. And furthermore, the average number of promotions was also higher when participants ordered using a third-party platform compared with the outlet's own website or app. As I mentioned, this research explored the different types of promotions that were present when participants were placing an order, including how prevalent these were and the rate of uptake by the participants. The range of promotion types that were observed are listed on the right-hand side of the slide here, including price promotions, upselling, upsizing, and product promotion strategies. It was found that price promotions were the most prevalent or commonly offered promotion type, and these had the highest rate of uptake by participants. The offer of a discount with the minimum spend was the most common kind of price promotion, and this was typically where a fixed sum or a percentage is offered off of the total value if a minimum spend is met, and this typically ranged from £10 to £30. Within the 106 orders observed, there were 86 instances where this type of promotion was offered, and that had an uptake of 47%. This type of promotion was predominantly observed when participants were ordering through a third-party platform, more commonly on the homepage where participants started an order, but in some cases it did appear multiple times in a single order. Price promotions offering meal deals were also prevalent, and these typically include several items such as a main dish, a side, and a drink for a set price. In total, there were 80 instances where this promotion was observed, and the rate of uptake was 40%. Follow-up interviews found that meal deals are often perceived as offering good value for money. The other promotion types, such as upsizing, where customers are prompted to choose a larger portion size, these were not as prevalent as price promotions were in this study, but were actually found to be taken up by participants at a high rate. Follow-up interviews found that upsizing was again considered to offer good value for money, but it was frequently reported that participants intended to order the larger size anyway, and that the promotion did not influence their decision to do this. Meanwhile, upselling promotions, such as additional items offered at the checkout or through pop-ups while browsing, these had a low uptake by participants, despite being highly prevalent during the ordering process. However, while it's clear that promotions are commonplace and are frequently used during orders, their direct impact on prompting on unplanned takeaway orders appeared limited. The follow-up interviews identified that participants primarily reported to order for reasons of convenience or a treat, with promotions rarely being the sole trigger. Instead, promotions could be the deciding factor when participants were already thinking about ordering, particularly where financial considerations were involved. In this study, promotions and marketing strategies were observed to impact on the volume of food ordered, with certain price promotions being particularly influential. Discounts with the minimum spend were found to encourage some participants to add extra items to reach the minimum spend threshold, sometimes leading to unintended over-ordering. Meal deals were also found to lead to more food being ordered, as participants perceived this to be better value for money. It had been hoped that this research would be able to provide an indication of the extra volume of food and therefore extra calories that were ordered because of an exposure to a promotion or marketing strategy. However, this calorie analysis could only be done for 7 of the observed orders, where there was both certainty around the extra items being ordered as a result of being exposed to a promotion, and where the calorie information for the item ordered was available on the outlet's website. And in many cases, no nutrition information was available. And so this is a limitation of this small-scale research, that while participants reported certain promotions having an influence on the volume of food ordered, we were unable to quantify what this means in terms of extra calories purchased. However, this does really highlight the lack of publicly available data on the nutritional value of food and drink that's purchased in the out-of-home environment. To conclude, this research highlights that consumers are exposed to a wide range of promotions and marketing strategies when ordering from the out-of-home digital market, particularly price promotions. Third-party platforms were the most prominent methods used by participants to place orders and played an influential role in their decision-making. Participants liked their ease, convenience, and the promotions that third-party platforms offered. Price promotions, such as a discount with a minimum spend and meal deals, were reported to influence participants to purchase additional food. Price promotions were also more prevalent when ordering from chain outlets or third-party platforms. Overall, this research addresses a gap in the evidence base to provide initial insight into the availability and the uptake of promotions and other marketing strategies in the out-of-home digital market, as well as indications on how these can influence consumers' ordering behaviours. I'll be happy to answer any questions on this research at the end of the webinar, but for now I'll pass over to Caroline to present the next piece of recent research that we've undertaken.
Thank you, Lindsay. I will share my slides. Okay, hopefully you can see that now. Just let me know if not. But yeah, I will share, this is the most recent publication which explores the nutritional content of popular out-of-home foods. So from the information that we have heard in the webinar, we know that in Scotland, almost everyone is purchasing food out of home. For many of the out-of-home foods that are available, there is, however, no requirement to provide nutrition information or portion size information. Additionally, our food composition databases, they do provide a best estimate for nutritional composition for a wide range of foods, but they haven't necessarily kept up with the rapid modernisation of foods available out of home, the increasing range of available meals, and the changing portion sizes. Therefore, there are some gaps in our understanding of the nutritional value of many out-of-home foods. So this research aimed to determine the nutritional value of popular out-of-home foods sold by small and independent businesses, and also to compare these values with the UK government daily recommended intakes. So this work built on analysis which Nesta undertook, and we focused on products which they did not include in their initial analysis and more bespoke products for Scotland. So 14 food items that were popular across independent out-of-home outlets in Edinburgh and Glasgow were selected. But for example, where they were popular but had already been analysed by Nesta, they were not included. For example, pizzas and fish and chips. So to select the food items, the most common menu items available from small and independent outlets, and the most frequently purchased or consumed foods were identified as the focus. So these images show some of the foods that were included in the analysis. The sample comprised 14 food items across 4 food categories, and those included meals, children's meals, starters, side plates and small dishes, and sweet snacks and desserts. Main meals included, for example, macaroni cheese, battered pizza, battered haggis supper, and more. The starters, side plates and small dishes section included, for example, pakora. Millionaire's shortbread was in the sweet snack and dessert section. And in the children's menu section, we had a children's portion of cheeseburger and chips and others. So as well as describing the nutritional content of popular food items, this research also aimed to understand whether this was associated with an area's deprivation level, as has recently been reported. So for both cities, outlets from the outward postcode areas based on the Scottish Index of Multiple Deprivation quintiles were sampled. So for example, if a city had proportionately more postcode areas in quintile 1, then they sampled more outlets that were located in areas in quintile 1. So outlets were selected based on being located in the desired postcode area, being an independent outlet, and serving the selected food items as a main or a standard menu item. 12 samples of each of the 14 food items underwent laboratory analysis to determine the nutritional content. Important to note is that every sample that was sold as a medium, standard, or a regular sized portion. The samples were weighed to determine the portion size, and then they were frozen and transported to a UCAS accredited nutritional testing facility. The samples were blended, aliquoted, and frozen until they were analysed. Then the samples were analysed for moisture, protein, fat, sodium, and fibre content, and the carbohydrate and energy content were determined indirectly using standardised formulas based on the results from the ASH moisture, protein, and fat analysis. So, key findings from this research included there being a wide range of portion sizes across the 12 samples of the same product, all of which were advertised as either being a medium, standard, or a regular size. For example, macaroni cheese portions had the widest range, with the smallest weighing 169 grams and the largest portion weighing 758 grams, with a median value of 450 grams. You can see the range of other two products given here as examples. But a wide range of portion sizes, of course, means a wide range of energy, fat, saturated fat, salt, and sugar contents. So for example, there was a 1,811 calorie difference between the smallest and biggest macaroni cheese sample. It also does tell us that there is some potential for some of those larger portions to be reduced, as they do exist elsewhere. Now to go through the energy, fat, and other macronutrient contents. First, to point out in the top right-hand corner, we have the daily recommended intakes for female adults and female children. These are what was used as the comparison in the research. Also to note that data shown in these slides are the median values from the 12 samples analysed for each type of food. And that is the case for all slides to follow unless otherwise stated. So we found that almost all of the products which were sampled were high in energy. The battered pizza meal contained 1,327 calories, which was the highest calorie content of all of the meals analysed. That equates to 66% of the maximum daily recommendation for adults. The Millionaire shortbread contained on average 590 calories, which is very high considering this would tend to be consumed in addition to a meal as a snack. The children's portion of cheeseburger and chips contained more than half of a child's daily recommended energy requirements. And to point out the pakora, which also would tend to be eaten as a side or a snack, contained a huge 767 calories. The saturated fat and total fat contents of many meals were also very high. For example, the children's cheeseburger and chips almost meets the daily limit for saturated fat with 20.9 grams. The pizza contains almost an entire day's worth of saturated fat for adults, and the Millionaire shortbread contained 83% of the maximum daily intake. The highest amount of total fat was found in one individual sample of macaroni cheese, which contained 161 grams in one portion. That's double the maximum dietary recommendation. But please note that this was not the median value, this was just the value in one of the 12 analysed samples. The children's meal contained 43.8 grams of fat, which is 68% of the daily recommended intake. And the doner kebab had the highest average fat content across all meals analysed, exceeding the daily requirement for fat with 86 grams. As we weren't able to calculate free sugar using laboratory analysis, total sugar has been compared to the reference daily intake for total sugar for adults. That's 90 grams, as outlined in the guide to creating the front of pack label for prepackaged products. There is no equivalent reference daily intake amount for children for total sugar. And as a reminder, total sugar is the sum of all sugars in a food or drink, including those that may occur naturally and those that are added. That differs from the free sugar recommendation, which the UK government make. Millionaire shortbread contained on average 34 grams of sugar, which was 38% of the maximum daily intake total sugars and 13% more than the recommended daily free sugar intake. The battered pizza and the doner kebab, considering they are savoury meals, they contained 12.8 and 8.4% of the daily maximum total sugar intakes, respectively. In terms of salt content, the battered pizza meal contains almost an entire day's worth of salt. The doner kebab contains 128% of the daily maximum intake, and the child's cheeseburger contained 68% of the daily salt maximum recommendation for children. Now, these results explore whether there was a difference in the average calorie content of meals depending on the socio-economic status of the area where the outlets were located. The socio-economic status is categorised using the Scottish Index for Multiple Deprivation, which is shortened to SIMD. SIMD1 represents the most deprived areas, and that increases up to SIMD5, which represents the least deprived. There were no outlets included in this research located in SIMD5, so those outlets in SIMD4 are considered to be in the least deprived areas in this research. The average meal calorie count was 782 calories for outlets in the most deprived areas. Meals in the less deprived areas, SIMD 2, 3 and 4, had slightly higher total calories per meal, with the highest calorie content analysed in foods from outlets located in SIMD 3. But important to note is that these differences were not statistically significant, so there doesn't appear to be disproportionate levels of calories in these meals depending on where the outlets were located. So to conclude all of the research that we have presented today, the Scottish population are frequently purchasing foods out of home, particularly food on the go and for snacking occasions. This could potentially contribute towards less healthy diets, since snacks are typically consumed over and above meals. They are also often discretionary products, such as confectionery, cakes, and biscuits, which are commonly high in energy, fat, and sugar. However, we don't yet fully understand how out-of-home intakes contribute towards the wider diet. And for example, whether people compensate at later meals or later days for the foods that they consume out of home. We've seen that minimum spend price promotions might encourage specifically those regularly ordering takeaways online, possibly to order an increased volume of food in order to get value for money. But it isn't clear how that might impact the overall diet. Some are purposely ordering for subsequent meals, where others are more spontaneously ordering to consume at that point in time. And finally, popular takeaway food items for both adults and children could contain more than half of their daily energy requirements and more than their daily total fat, saturated fat, and salt maximum recommendations. You will also notice that throughout I've highlighted the children's cheeseburger and chips. Given that that value is the average of 12 samples from different businesses, it does emphasise why we should be concerned about children's meals. Consuming these meals, the children and the adults' meals regularly, could negatively impact our health. They could contribute towards excess energy intake and hence potential weight gain. Also important to re-emphasise that this nutritional analysis was undertaken on single meals, but have been compared to entire daily recommendations and maximums. The most concerning relating to this is the likelihood that these foods would be consumed in addition to other daily food intake, for example breakfast, lunch, and possibly even alongside other food items, such as calorie-containing drinks, side dishes, and/or desserts. From a public health risk perspective, the high levels of calories and saturated fat identified in the samples are of particular concern. The findings do emphasise a need for continued collaborative support to improve the food environment out of home and to support businesses to improve the nutritional quality of the food that is offered out of home, including food that is available and marketed towards children. But to help answer some of the questions that this research has presented, we are about to embark on an out-of-home focused dietary intake survey to seek to address some of these evidence gaps. Thank you very much for listening. We really hope that you enjoyed hearing about the purchasing, digital promotions, and the nutritional analysis of the foods available in outlets across Scotland. Just to say that if you would like to keep up to date with the latest news from Food Standards Scotland, to receive news on our blogs, campaigns, or events, then please scan this QR code here. Also to note that these slides will be shared with you after the webinar via email, so you can access it then, and you can also get links to the publications there as well. Thanks again, and I'll head over to Sophie to open the Q&A session.
Thank you very much, Caroline, Clodagh and Lindsay, for your presentations. What I'm going to do before we move on to the Q&A, I'm going to share the poll again and ask that if you can all take a moment to answer the 3 questions that I'm just going to share. And this is just so that we have a comparison. So yeah, if you could please answer those 3 questions in the poll, and then you can ask any questions you might have, and we can open up the Q&A session. I've had a few questions come in already. Yeah, so please just ask away. So I'll just start answering, we can just start answering questions now. So I'll start with you, Laura. The first question we had in is the Scottish diet also high in sodium?
Yep, thanks for that question. I think the short answer is highly likely, but we do measure the intakes of sodium in a different way to the way we do other nutrients, and that's because we add salt to our food after we've purchased it, either during cooking or at the table. So we only can measure our intake of sodium using urine samples. And imagine that costs a lot more money to do than a regular kind of dietary intake surveys. The most recent data that we have for Scotland, therefore, is from 2014, so it is a little bit older than the other data that we have on nutrients in Scotland. And from 2014, the mean estimated salt intake for adults between 19 and 64 years was 7.8 grams a day. So that's around almost a third higher than the recommended 6 grams a day.
Thank you. Okay, a question for Clodagh. How are in-home purchases segregated from out-of-home purchases in supermarkets? Is it at the category level with assumptions that the category is likely to be consumed out of home, or is it from the consumer survey data?
So most supermarket purchases are classified as retail purchase, but out-of-home purchases in a supermarket would be things like meal deals and food on the go. So this largely depends on where and when the product is consumed, not what it is. So like if a sandwich was bought and a consumer recorded eating it immediately from a supermarket cafe, then that would be classified as out-of-home. But if it was bought as part of a weekly shop and sort of like taken home to eat later, then that would count as an in-home retail purchase. So yes, it's something that's a bit more difficult to define and kind of depends on how the consumers recorded it.
And another question for you, Clodagh, as well. Has the out-of-home data been broken down geographically for Scotland, or if not, is there plans to do so?
So it's not something that we looked at this time around. So it is something we have looked at in the past, but not with the data this year.
Fine. Caroline, what do you think we need to do about the unfavourable nutritional content of many of the out of home foods?
Thank you, Sophie. So I think whether it's through mandatory targets reformulation, action on advertising or promotions, really we need to try to create a healthier out-of-home food environment and to try to improve what is on offer. There isn't one single policy or action which can solve all of the problems, but there needs to be a number of actions together, collaborative multi-sectorial approaches to make the out-of-home environment more conducive to good health. Mandation is also important because we have seen that voluntary actions are not as effective. We are currently working in collaboration with Public Health Scotland to develop the Eating Out, Eating Well framework and the Children's Menu Code of Practice. So these are a set of principles. For example, one of them is reduce portion size, another is reduce fat. And each principle comes with key actions and top tips, and they're designed to support businesses to take steps to improve the nutritional content of the food that they are offering. So, for example, some of the tips might include using a smaller takeaway container or a standard ladle for portion size control, removing salt from tables, reducing the amount of fat added to a recipe. But we really need commitment to roll this out, and ideally it would be mandated in the public sector. They could be used as the exemplar, but of course the private sector do also need to play their part in making improvements to the food that is offered as well.
Thank you. Do we see certain demographics purchasing more out of home than others, Clodagh?
So we looked at gender and social class, and there were minor differences. So males tended to make more trips out of home than females, and those of a higher social class made slightly more trips, but there wasn't a large difference. And age wasn't something we looked at this time around. So yeah, thank you for the question.
When will the framework be launched, and will it be voluntary, Laura?
Yeah, we don't have a date yet for the framework. We are currently working on a proposal for how that can be implemented alongside Public Health Scotland and with Scottish Government. So unfortunately, I'm not able to share any further details at the moment, but just we can share that that is actively being discussed at the moment.
Clodagh, what do you think? What do you consider to be the most significant change in the out of home food and drink purchases in Scotland between 2022 and 2023?
So one of the changes and trends that we've been seeing over the past couple of years is the growth in snacking and the increase in demand for quick and convenience foods like food on the go. But I think combined with the increase in purchase and availability of sweet snacks, it's quite concerning with the sampling report showing these to be sort of 400, 500 calories per serving, especially when you consider those within the context of wider diet, and that they're on top of the calories we're getting from meals. And I think that the rise in food on the go is perhaps linked to the cost of living, with people choosing more lower cost options instead of sort of going out for full meals. I think maybe more people have returned to work and sort of activities after the pandemic. So convenience is quite important to consumers as well.
Definitely. Can we say anything more about the out of home intake survey that's planned, Caroline?
Yes, thank you for the question. Yeah, so the out of home intake survey is going to try to capture, firstly, using a dietary assessment intake 24 to first understand what is being consumed out of home. Then what we then also want to try to understand is the motivations and kind of reasons for consuming foods out of home, and try to get some insight into what motivates people to do that. Why are people consuming foods out of home? Is it convenience? Is it for a treat? That kind of information. And we want to also try to understand how the out of home intake fits within the wider dietary intake. Is it that people are compensating at later meals? If they are consuming a sweet dessert out of home, do they then consume less later on? Or could it potentially be contributing towards overconsumption of energy? We also want to try to understand, and it leads back to one of the other questions about the demographics of those who are consuming out of home foods frequently. So we want to try to understand whether there are certain characteristics of those consuming foods out of home regularly, and whether those differ to those who don't consume foods out of home regularly, and whether there are certain age groups or patterns in terms of working in the office or not in the office, and those kind of pieces of information. Thank you.
you. What limited the study on promotions to 29 participants? Lindsay.
Thank you. Yes, unfortunately, just resource cost and the time that we had available to conduct the research. It's also in qualitative research, tends to be smaller sample sizes. So that was the reasons for the 29 participants. Thank you.
Thank you. Laura, is there any research on promotions targeting secondary school children at lunchtime with meal deals?
Yeah, that's a great question. Not that I am aware of, and particularly not in Scotland. I certainly do know that that is a concern. There has been some research done, again, not recently in Scotland, but they have recently looked at it in England and also in Northern Ireland, looking at the density of outlets, so how many out-of-home outlets are available close to schools. But I don't think there's been anything more specific around what types of promotions are being targeted specifically towards school children, but that's definitely an aspect of concern and something that we would hope to address through the Eating Well framework.
Thank you. And we've had another question that I think you'll be able to answer, Laura. Are there any Western countries with similar issues that have done things right to change the dietary health of their populations that you're aware of, and that we could use as an example for policies to create positive change, obviously with regards to out of home?
Yeah, that's a good question. There are a few examples of things that have happened. One has been mentioned in the chat by somebody else that is kind of relevant to this debate and this discussion around out of home, which is around calorie labelling. And calorie labelling has been introduced for larger businesses in England and also in quite a lot of other countries, such as America, Australia, Canada, and probably some others too that I can't recall right now. That's been introduced for kind of two main areas of impact. One around providing information for consumers in order to support them to make informed choice, and the other around how that information being understood by businesses might translate into improving what they provide for consumers. And we have quite extensively looked at that evidence, and there has been a consultation on that in Scotland. And at the moment, we haven't, or in Scotland, the decision has been taken not to progress that due to quite a lot of concerns that came through that consultation around the potential negative impacts on eating disorders. But we are still really interested in that as an area, particularly around how it can influence business practice. So we will be taking forward some further research this year to look at a slightly alternative approach to actually the information being on menus without the choice of people being able to not see it, to potentially pivoting to providing that as on an on-request basis. And the rationale for doing that would be still making the information available to consumers, but also still being able to have that impact at a business level in terms of reformulating their menus. In terms of other examples, there are examples in Singapore where they have, again, focused more around the food reformulation aspect for out-of-home foods. They provided grants for businesses where they were able to make a particular claim around the calorie content being reduced of the foods that they provided. And so that is something that is of interest to us, but because they are providing grants to business, does come at quite a heavy cost. I think that would be the main examples that spring to mind in terms of other countries to look towards.
Thank you. And I suppose this could lead on. Will FSS's decision not to recommend mandatory calorie labelling be reflected in these frameworks?
I think the short answer to that is yes. The details and the content of the framework that was piloted last year is publicly available. I can put the link to that in the chat. That was piloted for 6 months with a number of businesses in Scotland, and there was an externally commissioned evaluation of that pilot, which I understand Public Health Scotland will be publishing the outcome of that very soon. And yes, obviously we will be taking account of the position of FSS within any proposal going forward as to what the framework would look like.
Thank you. Another question for Caroline. We used to have the Healthy Living Award to support and encourage businesses to offer consumers healthier food choices. They were audited regularly. Will there be plans to have a similar auditing or monitoring system in place?
Thank you for that. So we are not necessarily at the point of deciding practically how the Eating Out, Eating Well framework would work. Ideally, auditing or monitoring system would likely be favoured. However, we are not yet at that point of deciding on that. Thank you.
You. And then a question for Lindsay. When undertaking research that explores ordering behaviours, what action is taken to ensure that being part of the study doesn't influence or change their decision making or their
Thank you.
behaviour? Yeah.
So we acknowledge that taking part in studies such as this, it does have the potential to influence behaviours, either by feeling that they should order more often, since this is what we were exploring in this study, or by holding back on when they might have placed an order because they were being observed. So to minimise any impact of this, a number of steps were taken, including keeping the information provided to participants in advance to a minimum, while still enabling informed consent, and reassuring that participants there was no expectation for them to order any differently than usual. Participants were not asked to record any promotional emails, texts, or notifications received during the fieldwork, because it was felt this may draw too much attention to them. And so we really relied on the screen recordings to capture these and the follow-up interviews as well. We acknowledge it by being part of a study like this, it might have influenced behaviour, but we attempted to mitigate this as much as possible. But in the nature of this research, it always remains a potential limitation.
Thank you very much. Right, thank you so much, Lindsay, Caroline, Laura, and Clodagh. I think that we will finish up there. The slides will be circulated after via email, and we'll also I'll be able to share the recordings too, so you can pass that on to any colleagues who might have missed the webinar. But thank you very much all, and thank you all who attended, and enjoy the rest of your day. Thank you.
Thank you.